Hi, good afternoon. Welcome to Thursday Reading Live. My name is Vandana BS, one of the reading trainers from Needus Academy. So, as usual, let's start with a sample question from part B. But before that, let me know how many of you have joined this live segment? All right. Okay, I'll wait a few seconds so that others can join. Okay, so we have a new sample question here. So please do the question. I'll give you 2 minutes for this question. So here comes the question. So once again, good afternoon everyone. Okay, so did you all do this question? Cheydo. Hi Jomi, Monisha, good afternoon. Okay, I'll read this question, then let's discuss the answer. Okay, engane answer kitti nollathu check cheyam alle. The main purpose of the extract is to. So this is an incomplete question from, a sample question from part B, an incomplete question. Okay, so the main purpose of the extract. So what kind what category of question is this? It in the category of question aanu. The main purpose of the extract, and in this question they have not mentioned about the category. Either category anullathu mentioned alla. Okay, in this paragraph also they have not mentioned anything regarding the category. Either category anullathu parayunnilla. Okay, so any idea? Do you know which category? Hi Chinju, Needu, Divi, good afternoon. Thank you so much, Needu. Yes, Teachers Day aanale. Okay, thank you. Anyway, so yes, what category of question is this? Idu either category of question aanu? Any idea? Idu either category il varuna question aanu? Because question il avaru category koduthittilla. Okay, usually namukku 3 category aanu, 3 categories of questions aanu. So as you know, first one is guidelines. With the guideline aano, guideline which means set of rules and regulations or principles that you should follow, or maybe the staff should follow. And this is not a guideline. Idanathu instructions onnu alla koduthirikkunna, and the question is not about asking any kind of instructions or nothing. Okay, and what about the second category, manual or policy? Idu manual or policy aano? Let's check. Okay, and what about the third category, email, memo, notice? Appam ഇത് ഇമെയിൽ അല്ലെങ്കിൽ സെക്കൻഡ് കാറ്റഗറി ആണോ തേർഡ് കാറ്റഗറി ആണോ? ലെറ്റ്സ് ഫൈൻഡ് ഔട്ട്. യെസ് യോഗേശ്വരി, താങ്ക് യു സോ മച്ച് ഡിയ. ജെസിക്ക, താങ്ക് യു. യെസ് ദിവി, ഗ്രീഷ്മ, ഗുഡ് ആഫ്റ്റർനൂൺ. ഓക്കെ, സോ എനിവേ, സോ ഐ എം ഗോണ കണക്ട് മൈ ക്വസ്റ്റ്യൻ ടു ദ ഓപ്ഷൻസ്. ഓക്കെ, കണക്ട് ചെയ്യാൻ പോവാണ്. ദ മെയിൻ പർപ്പസ് ഓഫ് ദി എക്സ്ട്രാക്ട് ഈസ് ടു. സോ ഐ എം ഗോണ കണക്ട് മൈ ക്വസ്റ്റ്യൻ. ബിഫോർ ദാറ്റ് ഐ എം ഗോണ മാർക്ക്, underline the keywords. Main, purpose, extract. So these are my keywords. Okay, ningalkariam purpose chodikkumbo in one of the categories we are reading for the purpose. Oru category il nammal vaayikkunnathu purpose ariyan vendittana. And which is that category? Adu edu category ah? Yes Monisha, third category. Okay, so you can conclude, allengil we can conclude it as in the third category. Idu moonamthe category avanana chance. Either it will be an email or a memo, allengil oru notice aayirkkam. Okay, and I don't think that this is an email or a memo, because if it is an email or a memo, definitely it will be, or it can contain sender and the receiver. അയക്കുന്ന ആളും ഉണ്ടാവും, അത് റിസീവ് ചെയ്യുന്ന ആളും ഉണ്ടാവും, or the subject line will be there. പക്ഷേ ഇതിൽ അങ്ങനെ ഒന്നുമില്ല. There is no subject line, there is no sender, there is no receiver mentioned, so that we can categorize into the final one, which is a notice. ഇതൊരു നോട്ടീസ് ആയിരിക്കും. All right. Okay, so I'm going to connect my options. So the main purpose of the extract is to explain a recently developed process in treating vascular injuries. So my keywords korchu lengthy aayittulla options aanu, and my keywords explain, then recently, then process. Okay, so these are my keywords. Option B, to highlight the significance of tissue nanotransfection in treating mice. So my keywords highlight, then transfection and mice. Actually tissue nanotransfection nu parayunnathu you can take it as a single word. Adoru oru endha paraya, it's a procedure, so that we can take it as a single thing. Then option C, extract is to announce an innovation in the realm of regenerative medicine. So my keywords announce, innovation, regenerative. So these are my keywords from the options. Okay, അപ്പോൾ നിങ്ങൾ ഓൾറെഡി പാരഗ്രാഫ് വായിച്ചു എന്ന് തോന്നുന്നു. എ വെരി സ്മോൾ പാര. ആൻസർ അറിയാമോ? ഏതാണ് കറക്റ്റ് ആൻസർ? കമൻറ്റ് ചെയ്യാമോ? വിച്ച് ഇസ് ദ കറക്റ്റ് ആൻസർ, വെദർ ഇറ്റ് ഇസ് എ, ബി ഓർ സി? യെസ്. ഓക്കെ, യോഗേശ്വരി നോട്ടീസ് ആണ്. വെരി ഗുഡ് ഡിയ. യെസ് മോനിഷ, തേർഡ് കാറ്റഗറി. ജസീക, ദിവി, ഇറ്റ് ഇസ് എ നോട്ടീസ്. വെരി ഗുഡ്. യെസ്. അപ്പോൾ ആൻസർ ഏതായിരിക്കും? ഇതിലേതാണ് കറക്റ്റ് ആൻസർ? ഒരു ചെറിയൊരു ഷോർട്ട് പാരഗ്രാഫാണ്. ഐ റീഡ് ദ പാരഗ്രാഫ്. റീജനറേറ്റീവ് മെഡിസിൻ. ഓക്കെ, സോ ടോപ്പിക്ക് കിട്ടി നമുക്ക്. റീജനറേറ്റീവ് മെഡിസിൻ ആണ്, ദാറ്റ് ഇസ് ദ ടൈറ്റിൽ. ഇറ്റ് ഈസ് എ ബ്രാഞ്ച് ഓഫ് സയൻസ് വർക്കിംഗ് ടു ഫൈൻഡ് വേസ് ടു റീഗ്രോ or replace damaged tissue and organs, has taken a huge leap forward in recent years. A new technology called tissue nanotransfection embedded in a tiny chip can reprogram skin cells to repair organs and blood vessels. With certain kinds of DNA, one kind of cell can be converted into other types. So from these lines, maybe we can connect with, okay, we are not sure, but still we can connect with either option ആയിട്ട് നമുക്ക് trace ചെയ്യാം. You can trace with this last option, which is option C. അല്ലേ ആയിരിക്കാം. ഇന്നവേഷൻ എന്ന് പറയുന്നുണ്ട് ഇവിടെ, ന്യൂ ടെക്നോളജി കണ്ടോ, a synonym for innovation. So that is new technology. And in the realm of regenerative medicine, yeah, it's maybe option C. Then, with certain kinds of DNA, one kind of cell can be converted into other types. The non-invasive procedure involves placing a postage stamp-sized chip on the skin and sending a small electric current through it. The process delivers DNA vectors into the body in less than a second. So far, the research has focused only on animals growing blood vessels in an injured mouse leg in a week and generating nerve cells that help mice recover from strokes. Okay, so what is your answer? ഏതാ നിങ്ങളുടെ ആൻസർ? ഓപ്ഷൻ സെക്കൻഡ് പാരഗ്രാഫ് വായിക്കുമ്പോൾ നമ്മൾ വിചാരിക്കും മൈസ് ഇസ് മെൻഷൻഡ് ഹിയർ അല്ലേ, സോ ദാറ്റ് ഇസ് ദ കറക്റ്റ് ആൻസർ. ട്രീറ്റിംഗ് മൈസ് ആണോ? അതാണോ കറക്റ്റ് ആൻസർ? സോ വെദർ ഇറ്റ് ഇസ് ഓപ്ഷൻ എ, ബി ഓർ സി. ഓക്കെ, സോ ട്രേസ് പോയിരിക്കുന്നത് ജസ്റ്റ് ടുവേർഡ്സ് ഓപ്ഷൻ സി ആണ്, ടു അനൗൺസ് ഇന്നോവേഷൻ ഇൻ ദ റെൽം ഓഫ് റീജനറേറ്റീവ് മെഡിസിൻ. ഇവിടെ അനൗൺസ് എന്ന് പറയുന്നതിൻ്റെ വേർഡിൻ്റെ മീനിങ് എന്താ? ദ മീനിങ് ഓഫ് ദ വേർഡ് അനൗൺസ് വിച്ച് മീൻസ് it has a lot of meanings, ഒരുപാട് meanings ഉണ്ട്, but still here in this context the meaning is briefly explained. അല്ലേ, ഇതൊരു brief explanation ആണ്, of course. So announce here which means briefly explain അല്ലെങ്കിൽ brief explanation. Okay, another meaning is that say something very loudly. ഒച്ചത്തിലൊരു കാര്യം പറയുക, that's called announcing. Okay, so okay, a lot of answers. Let me check your answers. Hi Punni, good afternoon dear. Yes, Violet, Aaron, Neetu, Ezekiel, Chinju, Monisha, Deepa, Ripsi. Very good. Okay, correct answer. Answer is option C, to announce an innovation in the realm of regenerative medicine. So could you please tell me how you guys eliminated option A and B? നിങ്ങൾ എങ്ങനെ ഓപ്ഷൻ ബി ആൻഡ് എ എങ്ങനെ എലിമിനേറ്റ് ചെയ്തതൊന്ന് കമൻറ്റ് ചെയ്യാമോ? What is the reason for eliminating option A and option B? ഓപ്ഷൻ എയും ബിയും എന്തുകൊണ്ട് നിങ്ങൾ എലിമിനേറ്റ് ചെയ്തു? What is the reason? And as you know, we have 3 chances in part B. അല്ലേ, 3 options ആണ്. So we have 3 chances. One will be the correct answer. Then not mentioned ആണ് ഒരു chance. And another one is contradictory or opposite option. അല്ലേ, so yeah, why you have eliminated option A and option B? എന്തുകൊണ്ട് നിങ്ങൾ എലിമിനേറ്റ് ചെയ്തു? May I know the reason? Okay, Violet, A not mentioned about vascular injuries. All right, I agree with you. Okay, so we can eliminate option A because it is not mentioned, as well as recently developed process. ഇതൊരു പ്രോസസ് ആണോ? ഇതൊരു പ്രോസസ് അല്ല. Okay, process which means a method. ഇതൊരു മെത്തേഡ് ആണോ? ഇതൊരു മെത്തേഡ് അല്ല, ഇതൊരു ടെക്നോളജിയാണ്. Okay, so we can say not mentioned. And what about option B? To highlight the significance of tissue nanotransfection in treating mice. Highlight എന്ന് പറഞ്ഞാൽ it is showing something, അല്ലേ, emphasizing significance of, importance of. എന്തിൻ്റെ ഇമ്പോർട്ടൻസ് ആണ്? ടിഷ്യൂ നാനോട്രാൻസ്ഫെക്ഷൻ ഇൻ ട്രീറ്റിംഗ് മൈസ്. അതിൻ്റെ ഇമ്പോർട്ടൻസ് ആണോ ഇത്? Is it the purpose of this notice? So it's not only in എന്താ പറയുക, മൈസിൻ്റെ കാര്യം മാത്രമല്ല പറയുന്നത്, ആനിമൽസ് എന്നാണ് പറഞ്ഞിരിക്കുന്നത്. ഓക്കെ, സോ ദിസ് ഈസ് കോൺട്രാഡിക്ടറി ഓപ്ഷൻ, ഓർ യു ക്യാൻ സേ ഓപ്പോസിറ്റ് ഓപ്ഷൻ. ക്ലിയർ? സോ ആൻസർ ഇസ് ഓപ്ഷൻ സി, which is to announce an innovation in the realm of regenerative medicine. Okay, that's the correct answer. I hope it is clear. So now we are moving to the important one, which is the topic, yes, shingles. Okay, so we have a new topic here, shingles. എങ്ങനെ ഉണ്ടായിരുന്നു മെറ്റീരിയൽ? ഈസി ആയിരുന്നോ അല്ലെങ്കിൽ ഡിഫിക്കൽട്ട് ആയിരുന്നോ? ലെറ്റ് മീ നോ ഇൻ ദ കമൻറ്റ് ബോക്സ്. പ്രിൻ്റ് ഔട്ട് എടുത്തു ചെയ്തു എന്നൊക്കെ ഞാൻ വിചാരിക്കുന്നു. ആൻഡ് വി ഹാവ് എ ഫേസ്ബുക്ക് പേജ് കോൾഡ് Needhu's Academy Reading. Okay, അപ്പം ആ ഒരു പേജിലാണ് യൂഷ്വലി വി ആർ അപ്ലോഡിങ് ദ റീഡിംഗ് മെറ്റീരിയൽസ്. ഒരുപാട് റീഡിംഗ് മെറ്റീരിയൽസ് നമ്മൾ അപ്ലോഡ് ചെയ്തിട്ടുണ്ട്. ആസ് വെൽ you guys can do what? You can take the printout of the material and do the material, then end of the session. Okay. Yes, easy material ആയിരുന്നു അല്ലേ മോനിഷ? Okay dear. So, today I'm going to read the material, then I'll underline all the keywords from the material, then we will discuss the answers. Okay. Yes. Easy ആയിരുന്നു അല്ലേ? Okay. So, I'll do one thing. Tomorrow, which is the last one, right? Yeah, weekend Friday. So, I'll give you a very tough material tomorrow and let's see. How many of you have completed that material, that tough material within the limited time? Okay, yes. Okay, so I'm going to read the material, so please listen. Shingles is an infection caused by a virus. So there is a title. Okay, we all titles mark. So we have to underline all the titles from the text. So shingles infection and virus. Then the virus that causes shingles is called varicella zoster. It's the same virus that causes chickenpox. Okay, so my keyword shingles, varicella zoster, then chickenpox. You can think of shingles as getting hit twice by the same virus. Anyone who gets shingles had a case of chickenpox first, often decades earlier. Okay, so a lot of time indicating words mentioned here. First, often, earlier. Okay. Shingles grow up on one side of your body, usually in one specific area. The rash starts as a cluster of small bumps. These bumps look different than the surrounding skin and present differently on different skin tones. On darker skin, they may be pink, grayish, purple or brown. On lighter skin, the bumps appear red. So, the discoloration is mentioned here. Okay, according to the skin color, adinte endu paraya rashes in the colors are mentioned. The bumps will turn into fluid-filled blisters, which is also vary in presentation. They can be red, purple, brown or grayish depending on your skin tone. The blisters usually dry out and crust over within 7 to 10 days. Shingles can be a very painful condition and sometimes the pain lingers even after the rash has cleared up. About 1 million people get shingles every year. In the US, the risk increases as you get older. About 10% of people who have had chickenpox earlier will have shingles later. So, these are my keywords from text A. Okay, I think already you guys are very thorough regarding what are the keywords that you should underline. And I hope that these are your keywords. Ano? Okay, yes. Okay, so now text B. Shingles in pregnancy. Okay, so again I'm marking the heading. If you're pregnant and think you have shingles, talk to your doctor right away. You can take antiviral medication during pregnancy, and these drugs will shorten the course of the disease. The sooner you start taking an antiviral, the better the drug works. Not much research has been done on shingles in pregnancy, so there is no data on whether shingles increases the risk of miscarriage or complications such as preterm birth. Studies on shingles and birth defects are limited, but there is nothing to suggest that a shingles outbreak will increase the chances of your baby having birth defects. There is no research on whether shingles during pregnancy might cause learning or behavioral problems of your child later. If you get shingles while you are nursing, you will need to keep your baby away from the rash. There is no evidence that the shingles virus shows up in the breast milk. But babies can get chickenpox from contact with the blisters because chickenpox and shingles are caused by the same virus. If you have a rash on your nipples, you should pump and throw away the breast milk. It is safe to ensure once the blisters have scabbed over. Okay, so these are my keywords from text B. ഒരുപാട് repetitions of words ഉണ്ട്. അതൊന്നും നിങ്ങൾ underline ചെയ്യണമെന്നില്ല, but still you can underline a lot of words. Okay, and text C and text D is almost a pictorial. A table is mentioned. It's all about shingles 101, symptoms of shingles, risk factors of shingles. So what are the symptoms? Bullet points are important. Rash or blisters on a section of one side of your body, pain, burning, numbness or tingling sensation, sensitivity to touch, fluid-filled blisters. So these are the symptoms. And what about the risk factors mentioned? Aged 60 years older, then weakened immune system, undergoing chemotherapy or radiation treatment, experiencing recurrent shingles, taking immunosuppressants. So these are my keywords from the box. Okay. And text D, treatments ആണ്. So what are the treatments? There is no cure for shingles. അതിന് ട്രീറ്റ്മെൻറ്റ് ഇല്ല എന്നല്ല പറയുന്നത്, ക്യൂർ ഇല്ല, കംപ്ലീറ്റ്ലി നമുക്കത് മാറ്റിയെടുക്കാൻ പറ്റും എന്ന് അവർ പറയുന്നില്ല. ദർ ഇസ് നോ ക്യൂർ. ബട്ട് ആൻറ്റിവൈറൽ മെഡിസിൻ ക്യാൻ ഹെൽപ്പ് ട്രീറ്റ് ദ കണ്ടീഷൻ. Start the medicine within 3 days of a rash appearing. If you are pregnant, check with. So these are my keywords from text D. Clear alle? Any doubts underlining the keywords? Okay, so now we are moving to the questions. Okay, question number 1. Which medicinal intervention is recommended to ease pain associated with shingles? Where is it mentioned? And as you know, for each question 1 to 7, decide which text, whether it is A, B, C or D. ഇതൊക്കെ നിങ്ങൾക്ക് അറിയാവുന്ന കാര്യങ്ങളാണ്. But still I'm repeating the same thing because don't forget. Okay, so A ആണോ, B ആണോ, C ആണോ, D ആണോ എന്നുള്ളത് മാർക്ക് ചെയ്യുക. Information comes from, you may use any letter more than once. Okay, so what about the first question? What is your answer? Yes. അതിനു മുമ്പ് ഞാൻ എൻ്റെ കീവേഡ്സ് പറയാം. മെഡിസിനൽ ഇൻ്റർവെൻഷൻ ആൻഡ് പെയിൻ. സോ ദീസ് ആർ മൈ കീവേഡ്സ് ഫ്രം ദ ക്വസ്റ്റ്യൻ. മെഡിസിനൽ ഇൻ്റർവെൻഷൻ, പെയിൻ. പെയിൻ റിലീഫ് മെഡിക്കേഷൻസ് എവിടെയാണ് മെൻഷൻ ചെയ്തിരിക്കുന്നത്? വേർ ദ മെൻഷൻഡ് അബൌട്ട് ദ പെയിൻ റിലീഫ് മെഡിസിൻസ്? യെസ്, ചിഞ്ചു, ഗീത, അമൃത, കാരോലിൻ, പൊന്നി, ദിവി, മോനിഷ, എസീക്കിയൽ. യെസ്, വെരി ഗുഡ്. ഇറ്റ്സ് ഫ്രം ടെക്സ്റ്റ് ഡി. Okay, answer is correct. Okay, text D ആണ്. Yes, 1 second. Yeah. So answer is D. Second one. Okay, Grishma and Yogeshwari, very good, correct answers. Okay, second one. The preponderance of shingles and chickenpox. So my keywords, preponderance. I'm only marking preponderance. Okay, because shingles and chickenpox is actually the title, that's material, so you don't have to repeat the same. Yeah. So preponderance in the meaning in that. What is the meaning of the word preponderance? Let me know in the comment box. What is the meaning of the word preponderance? In the meaning. Preponderance of shingles. Yeah, answer is correct. Very good. Your answers are correct, but let me know the meaning of the word preponderance. I think the meaning in that. Yes, Grishma, Monisha, Yogeshwari, Caroline, Geeta, Ezekiel. Okay, yes. Chinju, Amrita, yes. It's not because preponderance, which means prevalence, spreadness of the condition, prevalence of the condition, okay? Affecting. So that is preponderance. Okay, yeah. Yes, answer is from text A. So this condition is affecting. So what is the prevalence of the condition? About 10% of people who had chickenpox earlier will have shingles, as well as in the last paragraph very clearly mentioned about the preponderance or prevalence of the condition. Okay, so answer is from text A. Very good. Yes. Okay, Ezekiel, due to important. Okay, Anish, it's text A. Okay, yes. Okay, actually the meaning here, which is preponderance, that means prevalence. Okay, yes. Third one, the onset of which condition can be expected during the nursing period. So my keywords, onset, condition, nursing. Yeah, so these are my keywords. Onset, which means the starting, beginning, of which condition can be expected during nursing period. Suppose, just imagine this is a short answer question. Either a short answer question and imagine Jaya, what will be your answer? In the answer. The onset of which condition can be expected during the nursing period? What is the answer here? Yeah. Your answer is correct? Yes. But my question is, if it is a short answer question, what will be your answer? Either a short answer question ആയിരുന്നെങ്കിൽ നിങ്ങളുടെ ആൻസർ എന്തായിരിക്കും? Which condition can be expected during the nursing period? Yes. What will be your answer? Which condition? Which condition? ഏത് condition ആണ്? Okay, answer is actually in text B, I agree. Okay, yes, Anish, Ponni, yes, Ezekiel, Amrita, Chinju, Monisha. Answer is correct. Okay, text B is the correct answer. Yes. Shingles ano? Is that shingles, Amrita? Onset of which condition can be expected during nursing period? Nursing period, which means it is mentioned in text B, right? Yeah, so let me check the answer. Okay, so what about that? But babies can chickenpox from contact with the blisters because chickenpox and shingles are caused by same virus. So, chickenpox aanalle, not shingles, chickenpox aanu. Okay, at the time, see, if you get shingles while you are nursing, you will need to keep your baby away from the rash. There is no evidence that the shingles virus show up in the breast milk, but babies can get chickenpox from contact. So, answer is chickenpox aanu. Yeah. Yes. So that is from text B. Yes, yes, Chinchu, Caroline, Amrita. Okay, very good. Chickenpox is the correct answer. Yes. Fourth one. How do shingles actually occur? Okay, so my keywords occur and shingles. Yeah. So what about fourth one? How it is occurring? How it is happening? How it's beginning? Yes, onset of shingles. Where is it mentioned? It's mentioned in text A. Okay, shingles show up, see, on the side of your body. So that means it's mentioned in text A. Okay, fifth one, the intake of which medication could increase the risk of shingles? Yes, Chinchu, Gopika. Ponni, yes, 𝐂𝐴𝐧 option, text A ana, very good. Okay, Amrita. Then, fifth one, intake of which medication could increase the risk of shingles? So, my keywords, intake, medication, and risk. Okay, so these are my keywords from the question. Yes. Let me know your answers. Fifth one. Okay, Chinchu, fourth one is not, yeah, okay, maybe mistake, Okay, yes, Monisha, Amrita, Geeta, Chinchu, answer is correct, which is from text C. Yes, Gopika, very good, text C, intake of which medication could increase the risk of shingles. But risk factors mentioned as well as symptoms mentioned in text C. Yes. So what is a risk factor? Taking immunosuppressants can cause shingles. Risk factors are. So answer is mentioned in text C. Then sixth one. Okay, Chinju, yes, text C and very good dear. Sixth one. How should a woman with shingles have to take care of her baby? So my keywords, woman, shingles and baby. Yes. Taking care of the baby, that if you are pregnant. So pregnancy and shingles, where is it mentioned? Pregnancy period shingles and tamilulla connection evide mention cheyidekkunne. How should a woman with shingles have to take care of her baby? Yes. Okay, Chinju? Okay. So that is in text B. Rendu perkano correct answer kitte. Chinju and Ponni, very good, very good. Okay. So others, what about others? Ninge answer kittila? It was a very easy question, right? Text B. See, it's all about that. Especially in the last para, it's all about how to take care of the baby if you have chickenpox or shingles. So answer is from text B. Seventh one, exceeding what age can be a triggering factor for shingles? So exceeding age, triggering. These are my keywords. Okay, exceeding age, triggering factor. Triggering factor, which means the risk factors, causes, and age exceeding. So I think answer is mentioned in the comment. Yes, seventh one. Okay, only Chinchu got the correct answer, right? Very good, dear. Answer is text C. Okay, text C, Anna. It is mentioned here, aged 60 years older or older. So exceeding. Okay, age 60 years ആണ്, one of the risk factors. Yes. Yes, Ponni. Anish, very good. Text C ആണ്, text C. Very good. So answer is C. So please do check your answers and endeavor doubt on you can comment it. Okay, so D A, B A, C B, C. Clear ano? Okay. Eighth one, short answer questions. Answer each of the questions 8 to 14 if in a word or a short phrase. That means maximum 3 words. Short phrase in the nariyamo. So short phrase which means combination of words. Okay, for example, in the ruled out. Okay, this is a phrase. Okay, so ruled out. Two word aanu, but it is a combination of word, that means phrase aanu. So short phrase which means maximum 3 words arigum. Okay, 2 or 3 words, not more than that. Each answer may include words, numbers or both. Eighth one, where can we learn about 𝐶𝐲 So my keyword where, then 𝐶𝐲, yeah. So these are my keywords. If you want, you can underline learn also, yeah. So we where, learn, 𝐶𝐲, yes. Okay, hi Steffi, easy material aanale. Okay, yeah. So what about 8th question, guys? 8th question answer in the where can we learn more about 𝐶𝐲? So 𝐶𝐲, which means the vaccination, okay, which is mentioned in already we have underlined the keywords, right? So it is mentioned in text D. Protection against shingles. No dear, actually they are asking you where you can find the information about the vaccination. Evidence information kittum nanu question. Okay, from where you can get the information. Yes, okay, very good Chinju. Correct answer Gopika, yes. Answer is from text D. See the last line. Learn more about 𝐶𝐲 on the National Immunization Program schedule. So here actually you have 4 words, but still this is the correct answer because you can't separate any words here. Okay, this is a name of the schedule. അതുകൊണ്ട് നമുക്കിവിടെ separate ചെയ്യാൻ പറ്റില്ല. There are 4 words. Okay, so in such occasions you can write 4 words. Okay, National Immunization Program schedule, you can't eliminate or you can't delete any of the words from this because it is a name. Okay, so answer is National Immunization Program schedule. Yes, 9th one. What age must be embraced by an individual to categorize him among the high risk group? Little bit lengthier question. Simple question, what age? Okay, so my keywords, age, individual, high risk. Yeah, so these are my keywords. So risk factors mentioned in evidana risk factors. Text C. Ano? Yes. So what age? What age is mentioned there? Okay. 60 years or older. Yes. Okay. Actually, if you guys are writing 60 years or old or older, etra words undu? 1, 2, 3, 4, 5, 6. 6 words are there. You should cut it down because age is already in the question. Adonde age namukku cut cheyam. And what about the rest of the words? 5 words. Okay, 5 words under. Again, you should cut. Appo engane ningal eliminate cheyum? Whether it is 60 years old or older. Idil edakka words nammal cut cheyan pattum? 3 words madi. So you can cut this as well as this. So answer is 60 years old. Okay, because they are asking what age. Ed age ana? 60 years old. Okay, that is the correct answer, which is 60 years old. I hope it is clear. Okay, don't write abbreviation. Okay, ഇപ്പോൾ years ഇങ്ങനെയാണ് കൊടുത്തിരിക്കുന്നത് വിചാരിച്ചിട്ട് don't write abbreviation like this. It's not mentioned. Okay, if abbreviation is mentioned, you can write the abbreviation. Otherwise, don't write. Okay, yeah. Okay, 10th one. The maximum dose of 𝐶𝐲 needed for an individual. Okay, so question is maximum dose and 𝐶𝐲. Yeah, so these are my keywords from the question. So what is the maximum dose mentioned? Again, 𝐶𝐲 is mentioned in text D. Already we know that from 8th question. So what about the answer? Yes, it is mentioned in text D. എത്രയാണ് dose പറയുന്നത്? See, 1 dose. Okay, dose is already there in the question, so don't repeat, don't write like 1 dose. Just write 1 or you can write this. Both are correct. Okay, or if you want you can write the figure or you can write word. Both are correct. Okay. Yes. Yeah. And yes, Gopika, your answer is correct. Only 1 is also correct. Yes. Chinju, only 1 is correct, but don't write only 1 dose because dose is already there in the question. 1 is enough. Okay, they are asking you maximum dose. So, you can write only 1 or 1. Yes. 11th one. The implementation of which treatment regimes can worsen shingles? Okay. Regimes, which means routines. Okay. So, implementation, treatment and worsen. So, these are my keywords. Yeah. Which treatment? That is the question. Either treatment. Yes, Ponni, correct answer 1. Yes, Caroline, Chinchu, Gopika, Rashmi, Monisha, yes, Yogeshwari, yes, correct answer. What about 11th one? The implementation of which treatment regimes can worsen shingles? Either treatment karanana shingles koodan chance ulladu. It can worsen shingles. What treatment? So, risk factors mentioned in text C. Okay, and which treatment can increase this kind of, worsen shingles? Actually, it is here. See, undergoing chemotherapy or radiation treatment. So, you can write chemotherapy. Okay, or you can write radiation treatment. Karanam, in the question they are asking you which treatment, not treatments. Either treatments aanu, which treatment? Okay, it's singular. Question is singular, so which treatment? Either treatment aanu. So, either you can write chemotherapy or you can write radiation therapy. Not radiation therapy, radiation treatment, yeah. Okay, and treatment is already here in the question. So, either you can write chemotherapy or you can write radiation. Okay, so this is the correct answer. Yes. Okay, Chinju, chemotherapy or radiation treatment. Actually, that is the correct answer, but you don't have to write both here. Either you can write chemotherapy or you can write radiation. Treatment vanda because already here it is in the question. Okay. Yeah. Yes, Ponni, Caroline, correct answer. 12th one. The discoloration shown by shingles in light-skinned people. So, what is the color? Discoloration, shingles, light-skinned. Yeah. So, these are my keywords. Discoloration and I'm not marking shingles, okay? Yes. Discoloration and light-skinned. What is the color? A lot of colors mentioned. I don't confuse the very clear question. Light-skinned people. Okay. Yeah. Very good. Yes. Yes, Gopika. Yes, Kuzang. Chinju. Yes, Geeta. Divi, Rashmi, it is red. Very good. Answer is yes, red. And where is it mentioned red? Text A. Direct answer, which is from text A. On lighter skin, the bumps appear red in color. So, answer is red. Yes, Ezekiel, Yogeshwari, yes, Puni. Correct answer, which is red. And 13th one, which microorganism is responsible for the spreading of shingles? Microorganism responsible spreading. Which microorganism? Either virus either organism which is responsible for the spreading of the condition. That's mentioned in text A, of course, I'm sure. Very good. Yes, Rashmi, varicella zoster. Okay, that's from text A. Yeah, first line. The virus that causes shingles is called varicella zoster. So, answer is varicella zoster. Yes. Okay, it's mentioned in text A. Very good. Yes, Caroline, Gopika, Rashmi, Yogeshwari, Ponni. Yes, correct or not? Varicella zoster. And 14th one. The presence of a rash on which area insist mothers to pump and throw away the breast milk. Okay, little bit lengthier question. And what are the options? I mean, keywords here. rash, area, and breast milk. Okay, so these are my keywords. Korchu lengthy aanu. Yeah. Which area? The presence of rash on which area insists mothers to pump and throw away the breast milk. If the mother is infected, അവർ പറയുന്നുണ്ട് condition കൊണ്ട് വലിയ പ്രശ്നമില്ല, but still, yeah, problems will be there. So, from which area you can pump out the blood, I mean, not blood, sorry, milk, breast milk, yes. Okay, it's mentioned in text B. So, what is your answer, Rishmi? Which area? It's mentioned in text B. Answer is? Okay, it's mentioned in text B. Yes. So where is it mentioned? Chickenpox. But babies can get chickenpox from contact with the blisters because chickenpox and shingles are caused by the same virus. If you have a rash on your nipples, you should pump and throw away the breast milk. So answer endana? Nipples. Okay, so that's the correct answer. And so that's the end of 14 questions. Then 15th one, fill in the blanks. Same instructions, you can write in a word or a short phrase. You can take dash during pregnancy and these drugs will shorten the course of the disease. So my keywords, during pregnancy, drugs, shorten. Yeah. So you can take what? Either drug aanu. What is taking during pregnancy? And these drugs will shorten the course of the disease. Yeah. So what drug? Either drug aanu. So the name of the drug during pregnancy, which is mentioned in text B, alle? Yes. And what is the drug mentioned here? Antiviral. Okay, antiviral medication. So answer is antiviral from text B. Okay, you can take antiviral medication. Okay, it's not medications, medication aanu. Okay, ഇവിടെ ചോദിച്ചിരിക്കുന്നത് drugs എന്നാണ്. So you can write here medication. It's not a problem. Okay, antiviral medication. And 16th one, on dash, the bumps may be pink, grayish, purple or brown. It's from text A, I'm sure. Okay, so on dash, the bumps may. So according to the skin color, aanu koduttirikkunne. So is it a lighter skin or a darker skin? Here it is. Darker skin, ano? Yes, I think so. Okay, let me read. Yeah, on darker skin, they may be pink, grayish, purple or brown. So answer is darker skin, yes. Okay, my answer is correct, yes. And 17th one, what about 17? People aged dash have free access to the vaccine of shingles. ഏത് ഏജിലാണ്? People aged free vaccine. Yeah. Okay, Rashmi, ade correct aanu. Ponni, yes, darker skin aanu alle. Not dark skin, darker skin. Okay. Okay, so ഏത് ഏജിലാണ് vaccination free എന്ന് പറയുന്നത്? Free vaccination available in which age? It's mentioned here. 70 to 79 receive the vaccination for free. So answer is 70 to 79. Okay, so that's the correct answer, 70 to 79. Then 18th one, babies can get dash from the contact with the blisters because chickenpox and shingles are caused by the same virus. Babies, contact and blisters. Yes, very good Chinju, 70 to 79 aanu. What about 18th one? What is the missing word there? Very good Geeta, answer is chickenpox. Okay, is it a two word? It's not a two word, right? Single word alle. Yes, chickenpox. Okay, that is the correct answer, which is mentioned in either text illa. Text B. No, there is no evidence that shingles virus shows up in breast milk. Babies can get chickenpox from the contact with blisters. So answer is chickenpox. Yes, it's a single word. Okay. Okay, 19th one. Yes, Caroline, Divi, Gopika, Ponni, Geeta, chickenpox. 19th one. It is advised to take antiviral medication within dash of rash appearing. So my keywords, antiviral medication and appearing. Yeah. 19th one the day. The day ആണോ? വിത്തിൻ ആണ് ചോദിച്ചിരിക്കുന്നത്. അപ്പം ഇത്ര ദിവസത്തിനുള്ളിൽ എന്നല്ലേ ഇതിൻ്റെ മീനിങ്? വിത്തിൻ ദിസ് മച്ച് ഡേയ്സ്. ഇറ്റ്സ് നോട്ട് ദ ഡേ. പിന്നെ എത്രയാണ്? വെരി ഗുഡ്, 3 days. ഓക്കെ, ആൻസർ ഇസ് 3 days. യാ. ഓക്കെ, ദിവി, Caroline, Gopika, yes, 3. It's not 3 dear, 3 days. Okay, 3 days should be there, within 3 days. Okay, it's mentioned in text D, I guess. Yeah, see, start the medicine within 3 days of rash appearing. So answer is 3 days. And the final question, around dash of people who have had chickenpox earlier will have shingles later. Okay, so around people and chickenpox. Yes. Yes, Amrita, it is 3 days. Very good, dear. What about question number 20? Around dash of people. Yeah. I think it's a ratio, the proportion they are asking you. So, it's mentioned in, yeah, here. About 10% of people, right? Yes. Okay, so answer is 10%, which is mentioned in text A. And the answer is 10% of people. So, anyone with 20 out of 20? That's the end. Yes. Undo, 20 out of 20 undo. Anyone with 20 out of 20? All right. So, let's do a very tough material tomorrow. So, please stay tuned. God bless you all. Thank you.